Lipoprotein is a conjugated protein having a lipid component, the principal means for transporting lipids in the blood. Very low density lipoprotein is a lipoprotein containing a very large proportion of lipids to protein and carrying most cholesterol from the liver to the tissues. Low density lipoprotein is a lipoprotein that contains relatively high amounts of cholesterol and is associated with an increased risk of atherosclerosis and coronary artery disease. It is also called beta lipoprotein. High density lipoprotein is a lipoprotein that contains relatively small amounts of cholesterol and triglycerides and is associated with a decreased risk of atherosclerosis and coronary artery disease. It is also called alpha lipoprotein. Chylomicron is large lipoprotein particle that is created by the absorptive cells of the small intestine. It transports lipids to adipose tissues where they are broken down by lipoprotein lipase. Hyperlipoproteinemia is a condition marked by an abnormally high level of lipoproteins in the blood. This consideration is true. Hypertriglyceridemia denotes high blood levels of triglycerides. It has been associated with atherosclerosis even in the absence of hypercholesterolemia, that is, high cholesterol levels. This consideration is true. Hypercholesterolemia is an abnormally high concentration of cholesterol in the blood. This consideration is true. Which of the following consideration about type 1 familial hyperlipoproteinemia is true? Type 1 familial hyperlipoproteinemia marked by the increased serum concentrations of chylomicrons and triglycerides which decrease if the diet becomes fat free, decreased concentration of high and low density lipoproteins which increases if the diet is fat free, and decreased tissue lipoprotein lipase activity. Familial chylomicronemia type 1 is caused by deficiency in lipoprotein lipase activity. This consideration is true. The coronary primary prevention trial demonstrated that treatment with lipid lowering drug could reduce the risk of death due to coronary heart disease. This consideration is true. Women taking Probucol should wait for 6 months after cessation of therapy before becoming pregnant. This consideration is true. Nicotinic acid plus bile acid binding resin has not proven effective in combating hyperlipidemia. This consideration is false. The ideal therapy for patients with elevated levels of cholesterol would lower the serum concentration of LDL cholesterol while raising the concentration of HDL cholesterol. This consideration is true. Agents which lower levels of LDL cholesterol tend to promote regression of atherosclerotic plaques. This consideration is true. Clofibrate is the drug of choice for the treatment of broad beta hyperlipidemia. This consideration is false. One advantage of gemfibrozil is that in addition to lowering blood levels of most lipids, it raises the level of HDL cholesterol. This consideration is true. Probucol appears to increase clearance of LDL cholesterol by a non-receptor mediated mechanism. This consideration is true. All of the following statements concerning cholestyramine are true except it works by directly binding cholesterol in the blood. All of the following statements concerning drugs which inhibit cholesterol synthesis are true except No special monitoring is required in patients receiving one of them. All of the following statements concerning nicotinic acid are true, except sustained release preparations of these drugs are largely free of side effects. All of the following statements concerning drugs which inhibit cholesterol synthesis are true, except members of this drug class are generally not as well tolerated as the older bile acid binding resins. All of the following statements concerning drugs which inhibit cholesterol synthesis are true, except several of these drugs tend to lengthen the sleep cycle. All of the following statements concerning the fibric acid derivatives are true, except cloffibrate is the drug of choice for therapy of type 3 hyperlipidemia. All of the following statements concerning the bile acid binding resins are true, except when used alone, they do not slow the progression of atherosclerotic lesions.